Imagine holding the key to understanding the complexities of the human mind, an essential guide trusted by mental health professionals worldwide, shaping the very way we see and respond to mental health challenges. Welcome to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, also known as DSM-5-TR, a comprehensive and authoritative resource that stands at the center of modern psychiatry. Let's begin with a question. How does society determine what counts as a mental disorder? How are these conditions defined, distinguished, and treated? The answers lie within the DSM-5-TR, a book that has transformed mental health care by providing a common language for clinicians, researchers, and students alike. Whether you're a medical professional, a psychology student, a caregiver, or someone seeking to better understand yourself or loved ones, the DSM-5-TR offers invaluable insight. But what exactly is the DSM-5-TR, and what can you expect to find inside its pages? Let's take a closer look at the book that has become the gold standard in mental health diagnosis. The DSM-5-TR is more than just a classification system. It is the product of years of collaborative research, clinical experience, and the collective expertise of leading psychiatrists, psychologists, and mental health professionals from all over the world. This latest text revision builds upon the foundation of the DSM-5, incorporating the most current science and clinical knowledge available to date. It reflects the evolving understanding of mental health, informed by the experiences of patients and clinicians navigating the challenges of diagnosis and treatment. Step inside and you'll discover a meticulously organized manual divided into carefully structured chapters, each focusing on major categories of mental disorders. From neurodevelopmental disorders that emerge early in life, such as autism spectrum disorder and ADHD, to conditions that may appear in adulthood, such as depressive disorders, schizophrenia spectrum disorders, and neurocognitive disorders like dementia, the DSM-5-TR covers the full spectrum. Each disorder is presented with clear diagnostic criteria, essential features, prevalence data, risk factors, and differential diagnoses to help clinicians distinguish between similar conditions. Imagine, for example, a young adult struggling with persistent feelings of sadness and hopelessness. The DSM-5-TR provides precise criteria for diagnosing depressive disorders, but it doesn't stop there. It also offers clinical guidance on distinguishing between different types, such as major depressive disorder, persistent depressive disorder, and other mood-related conditions. But the DSM-5-TR is not just a tool for diagnosis. It's a resource that helps professionals understand the underlying factors of mental health and illness. Each entry incorporates insights about cultural factors, age-related variations, gender differences, and the course and progression of each disorder. This context ensures that each patient's background and experience are considered, leading to more accurate and compassionate care. Let's explore a few of the major categories you'll encounter in the DSM-5-TR. 1. Neurodevelopmental disorders. These conditions begin in childhood and often have lifelong implications. They include intellectual disabilities, communication disorders, autism spectrum disorder, ADHD, and learning disorders. In this section, you'll find guidance on how these disorders present at different stages of development, their diagnostic features, and the latest research on assessment and intervention. 2. Schizophrenia spectrum and other psychotic disorders. Perhaps some of the most misunderstood conditions, these disorders involve disruptions in thinking, perception, and behavior. Schizophrenia, schizoaffective disorder, and related conditions are discussed in detail, with emphasis on the latest advances in diagnosis and evidence-based treatment. 3. Bipolar and related disorders. Mood disorders can profoundly affect daily functioning, relationships, and quality of life. The DSM-5-TR describes the range from bipolar I and II disorders to cyclothymia, including the diagnostic criteria for manic, hypomanic, and depressive episodes. It also offers clinical notes on differential diagnosis and comorbid conditions. 4. Depressive disorders. This chapter outlines the spectrum of depressive conditions, from major depressive disorder and persistent depressive disorder to premenstrual dysphoric disorder and others. Each entry includes insights into diagnostic challenges, epidemiology, and the influence of factors like culture and age. 5. Anxiety disorders. From generalized anxiety disorder to specific phobias, social anxiety, and panic disorder, this section helps clinicians identify and treat one of the most common categories of mental health issues, emphasizing both similarities and important distinctions among these disorders. 6. Obsessive-compulsive and related disorders. Here, you'll find detailed criteria and guidance for diagnosing OCD, body dysmorphic disorder, hoarding disorder, trichotillomania, and related conditions, along with up-to-date research on their prevalence and treatment. 7. Trauma and stressor-related disorders. This section addresses the impact of traumatic events on mental health, including post-traumatic stress disorder, acute stress disorder, and adjustment disorders. The DSM-5-TR offers a nuanced approach, recognizing the wide range of human responses to trauma. 8. Dissociative somatic symptom and related disorders. Explore conditions characterized by disruptions in memory, identity, and perception, such as dissociative identity disorder, as well as those with somatic symptoms that cannot be fully explained by medical conditions. 9. Feeding and eating disorders. Disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorder come with significant physical and psychological risks. The DSM-5-TR reviews defining features, risk factors, and essential points for thorough assessment. 10. Sleep-wake disorders. Modern life brings new challenges for sleep health. This chapter addresses insomnia, narcolepsy, sleep apnea, and more, recognizing how sleep issues intersect with other medical and psychiatric conditions. 11. Sexual dysfunctions, gender dysphoria, and paraphilic disorders. The DSM-5-TR approaches these sensitive areas with respect and clarity, providing definitions, diagnostic guidelines, and notes on contemporary debates and cultural considerations surrounding sex and gender. 12. Disruptive impulse control and conduct disorders. Understanding behavioral issues like oppositional defiant disorder, conduct disorder, and intermittent explosive disorder is essential for helping children and adults at risk for conflict with family, peers, and society. 13. Substance-related and addictive disorders. Addiction remains a major public health concern. The DSM-5-TR lays out detailed criteria for substance use disorders involving alcohol, drugs, tobacco, and gambling, while also discussing new trends and treatment options. 14. Neurocognitive disorders. This section explores the cognitive decline associated with conditions like delirium, Alzheimer's disease, and other dementias, guiding clinicians in assessment and care for aging populations. 15. Personality disorders. Personality disorders, including borderline, antisocial, avoidant, and obsessive-compulsive personality disorders, are covered with attention to diagnosis, course, and effective interventions. 16. Paraphilic disorders and other conditions. Here, professionals find nuanced discussions of paraphilic disorders and other conditions that require clinical attention, but do not fit neatly into other categories of mental disorders. Beyond its comprehensive classification, the DSM-5-TR strengthens the links between mental and physical health. It addresses crucial topics such as suicide risk, cultural formulation, and the cross-cutting symptoms that occur across multiple disorders. The manual recognizes that mental health does not exist in isolation, but is shaped by a person's biology, environment, community, and culture. And what's new in the DSM-5-TR? The text revision brings together the latest findings, updating language and terminology to reflect modern understanding and sensitivity. It features revised diagnostic criteria, new disorders, and advances in assessment that align with ongoing developments in neuroscience, genetics, and psychology research. The DSM-5-TR is designed for use by both clinicians and scholars, but its impact extends much further. Insurance companies rely on its classifications for coverage decisions. Researchers use its criteria to define populations in studies. Courts may consult its definitions in legal cases, and educators turn to its texts to train the next generation of mental health professionals. For families and individuals seeking answers, it offers clarity and guidance. Yet this influential volume is not without controversy or debate. The boundaries of mental health and illness are constantly evolving. Critics have raised questions about over-medicalization, cultural bias, and the challenges of diagnosis in complex cases. But the DSM-5-TR confronts these issues directly, offering updates and discussion points that encourage ongoing learning and reflection. Why does this matter for you? Understanding the DSM-5-TR opens the door to informed conversations about mental health, both your own and those of people around you. It helps break the stigma by replacing mystery and misunderstanding with knowledge and practical guidance. It invites us to approach mental health with empathy, precision, and hope. Whether you are a practitioner aiming for the highest standard of care, a student building your foundation of knowledge, or a reader seeking understanding, the DSM-5-TR is an indispensable tool. Mastery of its contents enhances your ability to recognize symptoms, communicate effectively with other providers, and develop tailored care plans that honor the complexity of each individual's experience. As we look to a future of increasing mental health awareness, the DSM-5-TR will remain at the heart of innovation and progress. Its commitment to scientific rigor and compassionate care reflects the evolving needs of people everywhere. Is the DSM-5-TR a great book? Absolutely. It is the definitive guide and a must-have for anyone involved in the care or study of mental health. Its influence cannot be overstated, serving as a beacon for accurate diagnosis, research, and treatment. If you're ready to deepen your understanding of the mind, to become a more effective clinician, researcher, or advocate, this book deserves a place on your shelves and in your daily practice. Thank you for joining us on this journey through the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision. If you found this introduction helpful, please like, share, and subscribe to our channel for more in-depth reviews and fascinating discoveries from the world of books. Ready to take the next step? Order the DSM-5-TR today using the link below the description and discover exclusive offers available only for our viewers. Expand your mind, enrich your practice, and join a global community committed to mental health for all. Thank you for watching.